Okay, I didn't hear what all you said.
All right. I'm saying, okay, perfect. Ma'am, I'm saying you are 68 years old, and as a young lady, as a responsible lady, you make your own healthcare decisions like you are the boss, you take care for yourself.
Yes,
Oh, perfect. And do you got any kind of state retirement plan, ma'am, from your current or your previous job? Like you got any medical assistance from your previous employee?
no.
Perfect. And you're still riding in the beautiful state of Ohio. What is your zip code in Ohio?
What is my zip code?
Yes, ma'am.
Oh, it's 43614.
3614. Got you. And to address you properly, ma'am, how do you pronounce your first and last name?
Vivian Taylor.
Vivian Taylor. Got you, Miss Vivian. Miss Vivian, that's pretty much all the information I needed from your side. Now, what can I do, ma'am? I will simply bring one of my best licensed agent, ma'am, that's working in your state, in your county. He will the person who can help you out and get you some more medical additional benefits to you and save you some more money, ma'am. That has no extra additional cost to you. Okay?
Oh, okay.
All right, ma'am. One last thing from my side, Miss Taylor. Do you receive your red, white, and blue Medicare health insurance card?
I have one.
All right. Before I connect it to licensed agent, ma'am, it's a requirement for Medicare side that did we take your permission to give you a call back in case we can disconnect it during this call, and this permission does not supposed to buy or purchase anything. Okay? So please say yes, ma'am, at the end of this agreement. Then remain on the line with me. I will connect your call to the licensed agent. Okay? All
Correct.
right, ma'am.
Correct.
All right, ma'am. Here we go, Miss Taylor. I will play disclaimer recording. Please say yes at the end, okay? All right, ma'am. Here we go.
I'll listen.
Before we proceed, I need your electronic voice signature that is the same as giving us your written consent to receive marketing communication by us or our partners via automated dialing system that will override all federal or state telemarketing and do not call laws. Your consent is not required as a condition to purchase any products and services including Medicare supplements, Medicare Advantage, and prescription drug plans. Your consent can be revoked through any reasonable means. Please say yes if you agree.
All right, is that yes, Miss Taylor?
I don't know. Can you send me something in the mail?
Yes, ma'am.
I
The
don't.
license agent will send you. Let me explain you what this is about. Okay. So the license agent will send you all the information as well in the mail. Okay. So when you connect right now, he don't send you the bunch of papers. He just specifies your need and send you all the information as well in the mail. Okay. And this disclaimer is actually to obtain your consent or permission to give you a call back in case we can disconnect it during this call.
Oh well,
This
I don't.
permission does not.
I don't see why I have to give you electronic signature to call me back. I don't
Like I
feel
said,
comfortable.
it's
I
even
don't
your
feel
numbers in
comfortable
any
doing
state.
that.
Let me explain you. It's about like if we got it even your numbers in any state or federal do not call list. Okay, so we have your permission to give you a call back. Okay, it's your only verbal authorization to let us call you back. Even your numbers in any state or federal do not call list. Okay, so don't have to worry about that. It's just your permission to give you a call back. Okay, don't worry about that. Don't hesitate to talk with the licensed agent. Okay, you don't have to purchase or buy anything over this call.
But I can't
Okay,
talk to a licensed agent without giving a
he will.
signature. I don't feel comfortable with that.
Ma'am, I just told you before that, like, you don't have to worry about that. It's your only verbal authorization to let us call you back.
Well, you can call
Even
me
your numbers in
back.
any state.
You can call me back if
Yes,
we get
ma'am.
disconnected. I'm not gonna give a I'm not gonna give a signature consent over the
It's
phone.
not signature. It's about yes. If
No,
you say
no.
yes, then I will connect your call.
I heard what it said. It said electronic signature.
Why
I'm not
signature,
gonna
ma'am?
do that.
Electronic voice signature.
Yeah, I'm not gonna
Oh,
do that.
well, let me explain you. Let me explain you what this about. This permission does not supposed to buy Medicare supplement plan, Medicare Advantage plan, prescription drug plan. Your consent can be revocable by any reasonable means. Okay. First, listen. We are 100% compliance with the HIPAA law, ma'am. You don't have to worry about that. We are 100% with compliance with the HIPAA law, and that's the reason we are talking with the person who are also compliant with the law. Okay.
Just connect me
Like,
with
so,
just go ahead and connect me with the agent.
It's a health insurance privacy protection act law. Okay, so we can have your permission to connect your call to the licensed agent. So that's the reason I'm asking to you. I will play once again for you. You can listen carefully. Then I will connect your call to licensed agent. Okay.
I'll listen, but I'm not going to give a signature online on
it's
the
not
phone.
Like
I can
you just say yes at the end.
You know, there is a phone number on the back of my Medicare card. I guess I can call them.
Well, listen, the Medicare doesn't call anyone. Okay, Medicare doesn't call anyone.
But you're calling me.
We can.
About
well, I'm
Medicare.
not from. Benefits. I'm calling you about Medicare benefits,
right.
okay?
Because Medicare. I can call the number on my card, and they will tell me my benefits.
Oh, I understand your concern, ma'am. Like you can call. We can also provide our number as well to you, okay? So you can call us back as well.
Well,
I will connect you right away. You don't have to worry about that, ma'am. I will talking with a lot of persons today, so I will I don't know what's the thing that you're holding you back. I don't know what happened to you. Well, I just told you that you don't have to worry about that.
I just don't give permission for anything over the phone.
We have your permission, ma'am, to give you a call back. Nothing else. You don't have to commit anything to purchase anything over this call, okay? You don't obligate to purchase anything. What happened to you? It's not about that. It's about that. If we got disconnected during this call, we have your permission to give you a call back. Even your numbers in any state or federal do not call list. Okay? Because it's a requirement for Medicare side.
Well,
so I will play once again for you. You can listen it carefully. At the end, say yes, and I will connect you.
Before we proceed, I need your electronic voice signature that is the same as giving us your written
consent to receive
marketing communication by us or our partners via automated dialing system that will override all federal or state telemarketing and do not call laws.
Hurry.
Your consent is not required as a condition to purchase any products and services, including Medicare supplements, Medicare Advantage, and prescription drug plans. Your consent can be revoked through any reasonable means. Please say yes if you agree.
All right, is it yes, ma'am? So I will connect you.
I didn't say yes.
Is it yes?
No, I didn't say yes. Hello?
All right, if you don't say yes, so I don't proceed this call. Okay?
Well, you
because
called me.
It's a requirement for Medicare side.
Well, I'll just call
we have to
Medicare.
Compliance with the law. We have to compliance with the law, so we don't proceed this call.
You called
if
me.
You don't say yes. We can call you back, but it's a requirement. It's a requirement. We have to go to the certain process. It's not about that. It's about compliance with the law.
What is it about?
I just mentioned that 2 times that you don't have to purchase any of the medical supplement plans, any advantage plans. You have to consent can be revocable by any reasonable mean. Okay. So if you say yes, then I will connect your call. Is Vivian?
Yes.
Are you listening to me? I'm saying if you say yes, then I will connect your call.
I don't understand the law. if you're calling about my benefits, I don't understand why it's required by law for me to give you a signature. I don't understand. Make me understand.
Ma'am, it's a health insurance privacy protection act law.
But
okay?
I've
Because we don't need any of your personal information unless you enroll in a plan, okay? So it's a requirement from Medicare side that the person is also compliant with the law.
what law
Because
is
it's
that?
actually
Explain the law. I need to understand the law.
even your numbers is well, we are not dealing with the person who are like on federal or state do not call list, okay? So if your number is not listed on the federal or state do not call list, so we have your permission to say yes, even your numbers in any state or federal do not
But my
call list,
number,
okay?
but
To
you,
connect you.
but you called me, so my number is not an unlisted number. You called me. Hello?
Oh, it's a requirement for Medicare side, ma'am. It's a requirement, so we have
I don't
to go through certain
understand the
certain
requirement. I've talked to Medicare before. They never said anything about a requirement by law.
Okay, ma'am, like I don't know, ma'am. Like, why are you just like wasting my time? Or
I'm not wasting your time. You called me.
if you don't like, we have to go through certain process, ma'am. You have to. You can listen it carefully. What the disclaimer say about? So I will play once again for you. If you say yes, then I will connect you. Okay. All right.
Oh, I'm confused. I guess just hang just
That will override all federal or state telemarketing and do not call laws. Your consent is not required as a condition to purchase any products and services, including Medicare supplements, Medicare Advantage, and prescription drug plans. Your consent can be revoked through any reasonable means. Please say yes if you agree.
Is it
okay.
yes?
Okay. Okay.
Is it yes, ma'am?
Okay.
I need your yes. I
Yes,
just told you
yes,
before
yes,
that I need
yes.
your yes.
Yes, because I'm not getting anywhere. Yes.
All right, here we go. Let me connect you. Here we go, ma'am. It's ringing for the agent.
Thank you for calling Medicare Benefits USA. My name is Sharon, and who do I have a pleasure of speaking with today?
Vivian Taylor.
Now, Vivian, it's nice to meet you, and I understand you're interested in hearing more about the benefits that you're entitled to, correct?
I guess so. He told me I have to do it some kind of law.
I don't know what the other person said, but I'm going to go ahead and do a review and make sure you're getting all the benefits
Where
that you're entitled to.
Okay.
Go ahead.
Where are you calling me from?
I'm in the United States.
Okay.
Okay. Now, as I'm doing the overall review with your benefits to see if I can lower any of your co-pays, increase any of your extra benefits like dental, hearing, and vision, and try to get as much money back into your pocket as I can. So how does that sound?
Okay.
Okay. Now, do you have Medicare Parts A and B?
Yeah.
And do you have any other coverage to go along with your Medicare?
No.
So just A and B.
Yeah.
And do you make your own health care decisions, or do you have a power of attorney to assist you?
I make my own decisions for now.
Okay, great. Now, first off, I have to let you know that all the calls are being recorded for quality training purposes, and that you do not have to provide any health information unless it's used to determine enrollment eligibility. I'm also required to let you know that we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. So please contact Medicare.gov or 1-800-Medicare to get the information on your options. Now you say you don't have any other coverage other than Medicare, correct? So no like VA benefits,
No.
state Medicaid, or anything
No.
like that?
No.
Okay. Right? Now, for compliance purposes, CMS
Hold this.
requires me to go over a brief disclaimer. And the Center for Medicare and Medicaid Services requires agents to document the scope of marketing appointment prior to any sales meeting to ensure an understanding of what will be discussed between the agent and the Medicare beneficiary. All information provided on this call is confidential and should be completed by each person with Medicare prior to the appointment. Medicare Health Benefits, an independent broker, represents various Medicare Advantage plans, prescription drug plans, hospital indemnity plans, and Medicare supplements. Medicare Advantage plans provide all original Medicare Part A and Part B health coverage and sometimes Part B prescription drug coverage. Medicare supplements are secondary insurance to original Medicare and helps cover some of the out-of-pocket costs after Medicare pays its share. By agreeing to this appointment, you agree with the sales agent to discuss the types of products we just listed. So please note the person who will discuss the products is contracted by various Medicare plans. They do not work directly for the federal government, and the individual may also be paid based on your enrollment into a plan, and agreeing to this appointment does not obligate you to enroll in a plan or affect your current enrollment. The agent will be prepared to discuss your
Okay.
options in your area and have materials available for you to review. Now, it is Wednesday, August 2nd, almost 9:50 my time. Do you agree to continue with
Can-
the appointment?
Can you hold on a second? My daughter is here. I'm gonna let you talk to her. Here.
Okay.
Hold on. Her name is Kelly.
Okay.
Hello?
Hello?
I'm
Yes.
just wondering
My
what.
name is Sharon.
I'm sorry, go ahead.
My name is Sharon. I'm a licensed agent. And go ahead.
A licensed agent for who?
I'm contracted with the various Medicare Advantage plans. This is what we call Part C.
Okay, so Part C, Medicare, if you're contracted,
Advantage.
what? Okay, yeah. What company do you represent?
Majority of all, WellCare, Aetna, Humana, Blue Cross Blue Shield. I mean, the list goes on.
That's interesting because I worked for Blue Cross Blue Shield in the Medicare department, and we didn't have third-party agents calling out for us.
Well, that was the problem. You were capitated into Blue Cross Blue Shield. Because we're not capitated. We're contracted with all the majority of the carriers.
And where can I find this contract?
I mean, you have my license number. That's where you can find where I'm contracted, who I'm contracted with. Because I am contracted with WellCare, United Healthcare, Humana, Aetna. I mean, you name it, it might be or may not. I mean, Devoted's another one. Because each carrier, as you know, has numerous plans.
I want to understand where you're working for. You have to have.
I'm working as an independent broker, and I'm contracted with the carriers.
Okay, what's your license number?
License number is, or I can give you my NPN number, is 19960831. All I'm doing is just a review for your mother's benefits to make sure, because it is coming close to also to annual enrollment period, and pending what's suitable for her needs, because she says she only has Medicare Parts A and B. Is that correct, or does she have a supplement plan?
I believe she just has the A and B, but she weird, that number is not coming up. But we were looking into other things for her, into the supplemental, but we didn't put her phone number out there for people to call her.
Once you're on Medicare, that's what happens. I also sell supplements, or deal with supplements plans as well. Those are majority are from the same carriers as well.
Well, isn't that what you're calling about? Is supplemental care?
It's both, right? But there's a Medicare Advantage plan, which is Part C, and then there's actual supplement plans that would have higher monthly premiums. It's all depending what's suitable for the client's needs.
And you're a government agency.
We're independent brokers. We do not work for the federal government. We have nothing to do. We don't touch Medicare A and B. We're just contracted with the carriers for Advantage plans, supplement plans, hospital indemnity plans, even prescription drug plans.
So you're the marketplace.
No, we're different from the marketplace. Almost, it's very similar, but definitely different. We don't deal with the ACA.
And why not?
Because we're not contract with the ACA. That's something totally different if you want to sell ACA, but it's the same concept. I mean, that's the Affordable Care Act. So
I know what it is. I worked in insurance. I was an underwriter.
Okay.
For Medicare Part C plans as well.
We work with Medicare. Excuse me?
If you work with Medicare, then that's a federal agency.
We are Medicare Advantage plans. We don't work direct. We're contracted with Medicare. We're contracted with the carriers.
So what kind of information do you need?
Well, I was just going to look up her zip code and see what she currently has with her in her Medicare file, so I can assist her to get her additional benefits because she only has Part A and B.
Okay. But how would you get her information? Because she's not going to give
All
you
I
her.
do is look up her. All I do is look up her file in the Medicare system. Like I said, we are contracted. Unless your mother stays on A and B, she's going to end up paying the penalty.
Okay. I guess my question is, if you're calling my mother, who is not, she's not a dummy, but you're calling these people, you're asking for their information, they're not reaching out to you. How do we know that you actually, because I just looked up your number, there is no NPN number it took me to a 404 page. There's no information on you. So I don't know what you're
I
trying
don't
to
know
get
where
at.
you looked at.
I don't know what
where
you're
you
trying
looked
to
at.
what
That's my
what
number.
information are you about to ask my mother?
Like I said, I'm just going to do a review. I'll look up her zip code, see what carries, what benefits are available, and take it from there. Just go through a review, see what's suitable, such as like dental, vision, hospitalization, the whole nine, and see. The only information I would need is just to pull up her file in the Medicare system to verify the information.
You're not answering my question. What information are you going to ask my mother?
Medications. Doctors, medications, if it comes to that point, if we find benefits that are suitable for her. The only information is to pull up her Medicare file through Medicare system.
Because I'm not comfortable with her giving you her social security number or any of
I
that.
didn't ask for that. I didn't ask for
But that's
that.
what I'm asking you.
Okay.
How do you think you're going to pull this up without some
This
sort
will
of
be with her
information?
Medicare ID number.
Yeah, that's not going to happen either.
Okay, but you know what? You two, best of luck in finding the benefits for her. Have a great day.
There we go. Another scam. I read about that